I always knew that I wanted to go into medical or dental. I got married and had 4 sons first, and then I went back to school for dental hygiene. We were taught how to do intra and extraoral screenings on all of our patients, and we were instructed that we should do it on every patient, every visit. And so I had a wonderful career. I specialized in orthodontics. And then I went on a road trip on the Labor Day long weekend in 2013, and I was in the Buffalo area. When I was driving home from that trip, I had an itch on my neck, and when I reached up to scratch it, I found an enlarged mass. And as soon as I started to palpate it, I realized that it was painless and it was fixed, and it was about the size of a quail egg. And when I looked in the mirror, I could see the outline of it, and my heart dropped into my stomach. I knew the minute I felt it that it was cancer. About 2 weeks before I found that lump, I had been visiting at a friend's house, and they had this old dog that they were babysitting for their daughter, and this dog had a tumor in her shoulder. And I sat there feeling her tumor, and I spent about 10 or 15 minutes just petting her and playing with this tumor and getting the feel of it. And that's literally how I recognized the texture when I touched that lump on my neck. So that dog saved my life. Talk about dog is a man's best friend. That gave it a whole new meaning for me. The following day, I called my family doctor's office and booked an urgent appointment. I went in and I showed him what I had discovered, and he went through all the questions and asking me if I had any soreness or if I had any chills or any other symptoms. I said, no. I said, this isn't a virus. This is cancer. I'm not sick. I'm physically well. And he thought that I was catastrophizing. So I finally got into the ENT, and he ran a lighted camera up my nose and down my throat. Didn't see anything. I told him right where to look inside my throat. He didn't see anything, and he asked if he could do a fine needle biopsy in office. And so I agreed to that. I waited 10 days and went back for follow-up and for the pathology report, and it was inconclusive. And he said, I really don't think that it's cancer. And I said, I promise you it is. And he would have none of it. The little voice inside of me just wouldn't stop. It was screaming at this point. And I was losing sleep over it, literally. And so I went back to his office, and I didn't call ahead or even book an appointment. I went in, his receptionist she wasn't very happy about that, but I insisted on being seen. I had gotten my boss to go down my throat with an intraoral camera, and I said, I have pictures I want to show you on a stick. I said, do you want to look at the pictures or do you want to scope me? I said, because it looks like there's a hemorrhoid right where my right tonsil should be. And he said, I'm going to scope you. And I told him exactly where to look, right behind the anterior tonsillar pillar on the right-hand side. And he put the scope up my nose and down my throat, and he pulled it out, and his whole demeanor had changed. And he said, now you've got me worried. He said, it doesn't look like cancer, but it's definitely not normal. I had booked a trip to take all 4 of my sons to Florida over Christmas because I was anticipating the news I was going to get wasn't going to be favorable. And while we were there on December 23rd, 2013, we were outside by the pool, and there were other guests by the pool, and my cell phone rang. Everyone, even the other guests, were absolutely silent. You couldn't hear any noise. And I picked up the phone, and it was the ENT. And he said, what are you doing? And I said, I'm in the sunshine in a bikini drinking a cerveza. And I said, I have a feeling that you're about to rain on my sunshine. And he said, I am so sorry. He said, I got the pathology report back, and it's squamous cell carcinoma. And I said, I just let out a big breath, and I said, I knew it. He said, I know you did. He said, I'm so sorry. And I said, what are the next steps? And he said, when you come back to Toronto, I'm going to put in the referral now for you to see a radiation oncologist at Sunnybrook Hospital. And that surgeon sat down with me and he said, I have to tell you that for this type of cancer, the gold standard is chemo and radiation. And he said, but I hear what you're saying. And he said, there is a controversial new surgery that's being performed. And he said, it's still highly controversial, but I feel that it could give you almost the same odds as if you go with the gold standard with the chemotherapy and radiation. He said, unfortunately, I can't perform that surgery for you here. I would love to do your surgery, but I can't because we don't have a robot. And he said, I know someone who does. An hour and a half later, I was downtown in consult with that surgeon. And he said, listen, I'm perfectly prepared to treat you with radiation alone. Your tumor is caused by the human papillomavirus. It's highly susceptible to the radiation. And I said, I appreciate that. Thank you. And then I told my surgeon, I said, I want surgery. My train of thought is if you can cut it right out of the body and get clean margins, that's going to be my best chance at surviving this. And he said, my motto is heal with steel, and I'm right there with you. And so my surgery was booked for January the 30th, 2014. My surgeon had obtained clear margins, and he said he felt really good about it, but a couple of the margins were just a little closer than he would like. And so he encouraged me to go ahead and move forward with the radiation treatment as a precaution in case any stray cells got missed. So for the first 3 weeks, I was okay, but then the pain really started to kick in. I wasn't able to swallow so well. My whole interior of my mouth, my cheeks, the roof of my mouth, the soft palate at the back of my throat, and my tongue began to fill up with third-degree burns. I'll never forget, every day before radiation treatment, I would sit upstairs on the floor of my shower and just cry and pray for about half an hour before I would leave to drive to the hospital. I have absolutely no regrets. I am here. I am almost 12 years cancer-free. I wouldn't change a thing. I wasn't shy to advocate for myself. And so I've been given opportunities to do patient advocacy to help other people along the way to be able to speak their truth also with their doctors and build that rapport. I'm passionate about sharing my story because we are still in the middle of a global epidemic. The numbers are not expected to level off with HPV-related head and neck cancers until at least 2060. HPV is a sexually transmitted infection, and we now know that it causes 100% of all cervical cancers. And now, especially in the Gen X population, they are seeing a whole host of cancers in the back of the throat, in the oropharynx region. The only thing that I can do that helps me to feel like what I've endured is worth the price I've paid is to try to make a difference, to help all of those to come to make their path a little bit better. Most head and neck cancers are diagnosed already at stage 3 or 4, which could mean a death sentence for people. And so I really try to impart the message that we have to be diligent with our screenings of our patients and be looking and diagnosing and properly educating our patients and letting them know what to look for in their mouth and what's normal and what isn't. We need to be able to diagnose these cancers early so that patients don't have to have as many treatment modalities or have as high of radiation. Maybe they can forego chemotherapy if needed and be treated with one modality as opposed to 3. And that's to lower the morbidity so that they have less side effects to deal with once they survive, so that they can move from survival to thriving. I want to break down the barriers talking about the human papillomavirus. It's the most common sexually transmitted infection that exists. 100% of Canadians will be exposed to at least one strain of HPV in their lifetime. and 50,000 Canadians will be diagnosed with HPV-related head and neck cancer similar to mine this year. So I devote my time to working on the things that I can impact change in an effort to inspire dentists and hygienists being on the front lines to remember that this isn't just a business model and a money-making industry. This is healthcare, and together we have the power to save lives.